I'm Dr. Shadine McLean. I'm a medical doctor working in the public sector. Some of the most common illnesses, we can divide it into chronic illnesses as well as cancers and gynecological illnesses. So we have the usual culprits such as hypertension and diabetes. And for gynecological and cancers, we have breast cancer and cervical cancer. Early warning signs that women should not ignore. One, if they're having continuous headaches or neck pain, and if they had checked their blood pressure and it's elevated about 130/80. The thing is, with hypertension, it is indeed a silent killer. So majority of the time, we don't have any signs or symptoms. So if it's a case where you're having that headache, that redness in the eyes, dizziness, blurry vision, that is when it's a little bit too much of a warning sign, right? Where your pressure might be a little bit too elevated. For diabetes, it's a little bit better in terms of presentation. So one, we can have an increased urination, where when you go to the bathroom, you're going to the bathroom frequently and you have a high volume of urination. Two, you're having an increase in thirst. And three, you're having an increase in hunger. In addition to that, you can have an increase in the body weight that you present with. A lot of women, they tend to have PCOS, where in PCOS they present with hormonal irregulation, where they're having irregular period, and they can sometimes have hirsutism, where they can have like mustache or any masculine hair growth anywhere. So persons with PCOS tend to have an increased risk of diabetes. In addition to that, for cervical cancer, we typically, if you're not doing your pap smears, if you see any abnormal discharge, for example, bloody discharge, or malodorous discharge with weight loss, you can tend to present to the doctor, because that might be an early warning sign of cervical cancer. We have risk factors that affect women in Jamaica. We have those that we can change, we have those that we can't change. Specifically with hypertension and diabetes, for the risk factors that we can change, like it has to do with our lifestyle. Now, it all comes down to our dieting and our exercise. From a young age, we tend to hear that we have to eat up everything on our plates, or else so we can grow big and strong, which our culture doesn't necessarily put us in the right direction to eating healthy. So the increase in the amount of carbohydrates, such as our dumpling or yam or banana, eating salty food. When we tend to season our chicken, we tend to put a lot of seasoning there, 1, 2, 3 seasoning, or we tend to eat fast food for multiple times because it's kind of easier. So if we're having bad diet and we're not exercising as well, it increases our risk of hypertension and diabetes.